Hello everybody, how are you doing? I hope things are going well and your studies are going smoothly. Welcome back. It's time for some more psychology revision. We're going to today focus on psychopathology and it's going to be the biological explanations for OCD. So, without further ado, let's crack on. Okay, here are some exam style questions that you can have a go at. It's one of those videos where you can press pause, give it a go. I would encourage you to do that if you can. Give yourself some time and space. Give yourself the opportunity to recall and practice, yeah? You've got timings on the screen there. Come back when you're ready, and I'll break the questions down and I'll talk through how I would tackle them and the kinds of things that you should be including. So here's your chance. Here it is. Press pause to practice. Okay, right, let's do it. The command word here in the first one is identify. So you don't need to explain it, you're just going to state it, you're just going to name it. The conditions that you learn, obviously OCD, phobia and depression, you could be asked about cognitive, emotional or behavioural characteristics. So try not to muddle those up, try to pay attention to which it is that it's asking for. Here is cognitive. Cognitive is about thinking, yeah, so something that's going to be internal here. Okay, so for OCD, the core one is obsessions. Now, because it's identify, you're done there, that's your mark. You could say, and it depends, what books you've looked in and what you've been taught, but another common one that we see is selective or excessive attention in terms of focusing on, the stimuli or the factors in the environment that would trigger those obsessions or trigger that anxiety, okay? So selective attention could be something that you mention, but obsessions, just go for it. Why would you not say that for OCD? Okay. Second one. Briefly outlined, so we're just showing knowledge, then neural explanation for OCD. Now, biological explanations for OCD split into neural and genetic. Neural itself splits into bits of brain and what they do, and neurotransmitters and what they do. So you can pick, as long as you don't do genes here. Yeah. So, let's say, and we'll cover more of this as we get to the bigger questions, but let's say we just went for the neurotransmitter stuff, yeah? So, for 2 marks, you could just say something along the lines of, serotonin and dopamine are linked to OCD. It's thought that low serotonin and high dopamine are responsible for the condition. That'll do, yeah? You've named the neurotransmitters, you've said that it's about high or low, okay? Alright, now we want to outline the role of genetics in OCD, okay? So specifically genetics, it says, yeah? Okay, so slightly more for 3 marks. It depends what genes you've been taught. There are a few that have been linked to OCD, yeah? Quite a few, as we'll come back to later. But some of the key ones, you've probably learned about the COMT and the SERT gene and their role in OCD. So you could get 3 marks just from talking about those. So the COMT gene is involved in the regulation or the breakdown of dopamine in particular. And so that means that dopamine isn't effectively broken down enough so that we end up with high levels of dopamine in OCD. Okay, now I wouldn't really go any further than that because what we're doing there is obviously straying into the neurotransmitter side of it. So focus on the gene. So it's the COMT gene, and having a certain variation of that is thought to cause OCD because it has an impact on dopamine. The SERT gene, it's called the SERT gene because it's the serotonin transporter gene. It affects the transport of serotonin. And basically, all you need to say in a description of the genetics is that having a certain variation of the SERT gene is thought to cause OCD because it leads to low levels of serotonin. Yeah, we're not going to go, as I said, further in terms of the neural side of it because it is just genetics focused, this question. You might be aware of the 5-HT1D beta gene as well. Again, depending on what sources you've read. And again, that's linked to serotonin. You could, again, I personally see this more as something that you would throw into a bigger question or even an evaluation and discussion question. But if you're talking about genetics, you could also talk about the fact that OCD is seen as polygenic. Yeah, there are over 200 genes linked to the condition. You could also say that OCD is inherited or passed down in families. But in terms of getting all the marks there, I would try to focus on specific genes if you can, okay? Okay, so we've now done the top row. That leads us on to a nice application question, okay? So let's have a little whip through this. So we've got 2 students, they're talking about OCD. Dan's talking about his friend who's got OCD, and he's saying, oh, it makes sense because her mum's got these characteristics of it. Tanvir says, well, actually, we've been learning about how it's to do with stuff going on in the brain, as opposed to maybe parents having it. And we're asked to refer to the conversation and outline biological explanations for OCD. So hopefully what each person is leading you towards there is a particular side of the biological explanations. Yeah. So Dan, hopefully you've picked up, is talking about the genetic side of it, talking about, parents having it, maybe that's being passed down. And Tanvir is talking about the neural side of it, yeah, stuff that's going on in the brain. So straightforward enough in terms of a 6-mark application question. You could split it into kind of thinking about it as a 3-mark plus 3-mark kind of affair. But what you do need to do, obviously, is show knowledge. So outline it, get that key terminology in, and then link it into what Dan and Tanvir are saying. So if we start with Dan, I would just start this answer off with something like, one explanation for OCD is the role of genetics. Talk about what we said already in terms of the CERT gene and the COMP gene, maybe the 5-HT1D beta gene, but just one or two of those would be fine. And link that into what Dan is saying and say, well, genes are passed down through families, through inheritance, and perhaps that's why Dan's friend has OCD, because her mum would have passed down those vulnerabilities in terms of her genes to her. Yeah. In contrast, Tanvir appears to be talking about neural explanations for OCD. The neural explanation involves different regions of the brain and neurotransmitters, and again, we'll do this in a bit more depth when we get to the bigger questions, but it depends what you've learned here. The neural side of it, you could talk about things like the worry circuit, you could talk about the role of the parahippocampal gyrus, you could talk about the role of basal ganglia. Again, like I said, depends what you've learned. Or you wouldn't have to do both because we're only really looking for 3 marks on the neural side of it. So you could talk about serotonin and dopamine again. Yeah, as long as you've got some knowledge, you've got some terminology, and you're linking that to what Tanvir is saying, yeah? Okay. Right, the next one, we've got explain one strength of the neural explanation of OCD. Okay, so it doesn't feel too intimidating, hopefully, in terms of only being 3 marks, but it is an evaluate question, yeah? And you do need to focus on a strength. And the other thing to pick up on here is it's specifically the neural explanation. But don't panic, because that doesn't mean you need to know specific evaluation for the neural one, as opposed to just biological in general. Yeah, you can talk about something that would apply to both biological explanations, as long as it applies to the neural one, yeah? And you say neural in the answer. So don't feel like you need to learn, a specific study that is just on neural. So as strength, one of the key strengths of the biological explanation is real-world application. Now, this does honestly apply more to the neural one than the genetic one. But one of the strengths is real-world application in terms of treatment. So understanding the role of neurotransmitters and the effect they have on thinking and mood, yeah, things like serotonin, has led to the development of drug therapies, for example, SSRIs. These have been shown to be effective, which demonstrates the real-world application or the practical utility or the value or something like that of the neural explanation of OCD, yeah? So you've got a kind of point, explain, conclude kind of structure there, all right? That would be a key strength. You could talk about research support because, there are lots of studies that have been done showing that brain activity, from brain scanning studies, is different in OCD patients compared to control patients, control participants, in terms of certain areas of the brain, like the worry circuit, the OFC, the parahippocampal gyrus, and things like that you might be aware of. Or you could actually use the fact that research shows drugs that target serotonin work, because again, that supports the role of serotonin. Yeah, if low serotonin is a problem, and you fix the serotonin in a study, and they improve, that supports the idea that serotonin was part of the problem, which is the whole explanation. Anyway, 1 point, explain it, conclude it. Okay, here we want to explain a limitation of biological explanations of OCD. So it opens it up a bit more. It doesn't have to be specific to neural, but it is very much a limitation. Okay, so again, for 3 marks, I'd be looking for a point, explain, conclude it. It is only one limitation. Again, like the previous question, if you go off on a tangent and talk about 2, they will probably mark them both and take the highest, but they will definitely ignore some of your work. So don't waste your time. Okay, a limitation. What kind of things could we talk about? Well, you could go down the route of talking about determinism. Yeah. So biological explanations of OCD say that the condition is purely linked to these biological factors that are causing you to have certain characteristics, and there's no kind of free will or no way of kind of trying to resist that. It's just a case of you've got this gene, or you've got this combination of genes, you've got these levels of neurotransmitter, you've got this brain activity, and kind of that's it. That's the cause of OCD. So you could go down that route and talk about determinism and the fact that it maybe excludes free will and doesn't really empower people to do anything about their condition. You could talk about reductionism. Yeah, any mental health condition, any behaviour, to be honest, is a complex combination of cultural and social and psychological and biological factors. Yeah, and what this explanation does is it boils OCD down to the lowest level of reductionism, purely explaining it in terms of neurotransmitters, genes, biology. So you could go down that route and say that maybe it's too reductionist, and a better explanation of OCD would include a more holistic approach where we also kind of look at the role of free will and cognitive factors and behavioural factors and the environment and all of that. Yeah, a more interactionist approach. Okay, so that's that one done. That brings us to a slightly bigger question where we're just going to evaluate biological explanations generally. So this could be strengths or limitations, but for 6 marks, hopefully it's not a surprise. I'd be looking really here for, point, explain, conclude, do it twice. Yeah. Now in terms of the difference between your 3 mark and your 6 mark questions, this is probably going to be levelled, yeah, as opposed to a 3 marker, which will probably, not always, but probably be something like, 1 mark for a brief explanation, 2 marks for some detail, 3 marks for like a thorough, detailed, elaborated evaluation point. So with a 6 marker, it's not so much, 1 mark for this, 1 mark for this, 1 mark for this. It'll be, to get into that top band, you want it to be thorough and effective. It needs to be coherent. It needs to be well explained. And kind of have some kind of structure or kind of flow quite well. Okay, so it's a bit more holistic in terms of it being a bigger question. But in terms of getting enough content there for 6 marks, I would say 2 points is absolutely fine. So you could use the 2 we've already talked about, and we'll introduce some other points as we look at the bigger questions in a minute, okay? All right, the next one, we're going to describe and evaluate the genetic explanation for OCD. Now this is probably going to be a 4+4. If you look at the command words, describe and evaluate, you want to show knowledge, you want to show evaluation skill. So probably going to be a 4+4, but it could be a 3+5, because one way of thinking about it is it's just a half a 16 marker. But it doesn't really matter. You won't know on the day. It doesn't really matter. You just need to know that you're going to cover both of those skills. Okay. The thing to focus on here is that it does specifically say genetic. So earlier we talked about things like the COMT and the SERT gene and the 5-HT1D beta gene. So throw that in. Throw in, I said this earlier again, in terms of a bigger question, throw in things like the fact that it's polygenic. There's over 200 genes that are linked to the condition. It's inherited, it's passed down in families. Yeah, that's enough knowledge for the genetic explanation. In terms of evaluation, we've got 4, possibly 5 marks of evaluation to cover here. I'd say maybe 2 points or one that is, fully developed and maybe then a counter argument and brought back together at the end. Okay. So in terms of specific evaluation for the genetic side of it, you could talk about reductionism and determinism again. All of that applies. We talked through that earlier. But you could also talk about research support. You could bring in family studies and twin studies, yeah? So twin studies have been done. You might be aware of the one by Nestat et al., comparing concordance rates for MZ and DZ, monozygotic and dizygotic twins, yeah? Remember that monozygotic is identical twins, dizygotic is non-identical twins. Now, the concordance rates are quite different. Yeah. So in terms of the monozygotic and dizygotic concordance rates, the fact that the monozygotic concordance rates are consistently, around double the dizygotic rate, so kind of, into the 60s and 70s in a lot of studies, versus the dizygotic kind of around the 30s, that shows you that genetics are involved in OCD. Yeah, it doesn't prove, we'll come back to that in a second, but it does support the idea that genetics are involved in OCD, because monozygotic twins are identical, remember. Dizygotic twins only share half their genes. So when you compare those, any difference in the concordance rates should be because of that difference in genetic similarity. So that supports the role of genetics in OCD, as I said. But let's take this a bit further, because if OCD were entirely genetic, and you've got twins that are identical, you've got MZ twins, then surely what should the concordance rate be? It should be 100%. Yeah? If you've got a co-twin with OCD, and they've got someone that is 100% identical to them, if OCD is genetic, that person should have it as well, because they've got the same genes. Okay, so what does that mean? Yeah, we've talked through, if this was a discussion paragraph, we've talked through the point that there's research support. We've said twin studies show MZ concordance rates is greater than DZ concordance rates. This supports the role of genetics in OCD. Despite this, if OCD were genetic, the concordance rate for MZ twins should be 100%. It's not. So where are we? This suggests that other factors are involved in OCD, not purely genetics. This casts doubt on the genetic explanation for OCD, suggesting it's only a partial account of the condition. Yeah, so it's a nice chunky developed paragraph with a counter argument there. Other things you could talk about. You could say that the genetic explanation has poor predictive validity. Yeah, understanding that you've got a particular gene variant, even if it is the COMP gene or the CERT gene or whatever, that doesn't actually tell you if you're going to get OCD. Yeah, it's only one small part of the picture. We understand, as I said, there's over 200 genes that have been linked to OCD. So just knowing that you've got that one or two particular, even 10 particular genes, you're still not necessarily for sure going to get OCD. So it's got poor predictive validity, the genetic explanation. You can't, from that information, predict whether someone is going to get OCD. And to develop that further, a lot of the genes that we've talked about are linked to other conditions. So even if you have got, an abnormal variant of the CERT or the COMP gene or whatever, some of these things are linked to things like Tourette's syndrome. Yeah, the COMP gene has been linked to schizophrenia. So even if you have got these variants, you don't know if you're going to get anything, and even if you are, it might not even be OCD. Again, poor predictive validity. Okay, I've said far too much for that one, but the aim there was really to give you some ideas that you could talk about. The key point being a bit of knowledge at the start, a couple of evaluation points, or one, big chunky developed one. Okay, the last one, discuss biological explanations for OCD. I won't take too much more time here because we've talked about so many different things. Just a quick breakdown. Discuss, so you need to show knowledge and evaluation skills. Try to string it together in terms of some counter arguments, try and make it flow. But in terms of your 16 marks, you've got a choice here. It does say biological explanations. So I would be tempted to say, well, that's plural, so you need to try and cover both. Doesn't matter what order you do it in. But I would potentially break that down in my head to being kind of 2 8 markers, and within that kind of go, well, let's do 3 marks of knowledge for genetics, let's do a couple of Peel-style paragraphs on genetics for the evaluation, or maybe a big chunky one, so that's your 8 marks on that. And then switch over to neural, do 3 marks of knowledge on that, talk about, maybe the worry circuit, or the OFC, or the parahippocampal gyrus and its role in emotion processing. We've talked about some of this already. And then do, again, a couple of discussion paragraphs on that, like Peel-style ones. Okay, and that's it. That's all you need to think about. So 6 marks of knowledge there, 10 of evaluation, and it's biological explanations. So I'd split that in half. Think about it as, half of it on genetics, half of it on neural. Okay? All right. So how's that gone for you? What happened with the ones that you tried? Why did it happen? It's time to reflect. And so what? Maybe it went great. Fantastic. Take that. Give yourself a pat on the back. Be proud. And then think, okay, well, did it go perfectly? Could I have done it quicker? Did I forget a particular key term that's probably quite important? Yeah. So take the wins when they're there, but also, eyes on the prize. it's going to be a little bit tougher on the day in the real exam. You'll feel a bit more stressed. So do try and fill any gaps. Alright, thanks very much guys. I hope that was useful for you. Keep it up. You got this. That's it for today. Bish bash bosh.